Assalamualaikum and hello everyone. In this video, we know AMIRAH and one Aisyah ADIBAH would like to talk about the cocaine, which is what is cocaine, the use of cocaine in medical field, how cocaine is misused, and how it affects the body, the cause and risk factor of cocaine abuse, the sign and symptom of cocaine abuse, and lastly, the treatment for the cocaine abuser. So, what is cocaine? Cocaine is tropine alkaloid that acts as a central nervous system stimulant that increases energy level and keeps people awake while raising heart rate and blood pressure. Cocaine also makes people feel good by flooding the brain with dopamine, one of the chemical messengers that increase feeling of pleasure. Cocaine is a powerful addictive stimulant drug made from the leaf of the coca plant native to South America. In the early 1900s, purified cocaine was the main active ingredient in many toxins and elixires developed to treat a wide variety of illness. Before the development of synthetic local anesthetic, surgeons used cocaine to block pain. Although healthcare providers can use it for valid medical purposes, such as local anesthesia for some surgery, recreational cocaine use is illegal. Today, cocaine is a Schedule II drug, which means that it has high potential for abuse but can be administered by a doctor for legitimate medical use, such as local anesthesia. As a street drug, cocaine looks like a fine white crystal powder. Street dealers often mix it with things like cornstarch, talcum powder, or flour to increase profits. They may also mix it with other drugs such as the stimulant, amphetamine, or synthetic opioids, including fentanyl, that especially risky when people using cocaine don't realize it contains this dangerous additive.
Cocaine is a powerful stimulant and has some legitimate medical applications. The American Academy of Otolaryngology had and neck surgery recognizes cocaine, such as cocaine hydrochloride, also known as medical cocaine, as a valuable anesthetic and vasoconstriction agent. The organization also stated that no other single drug could replicate the anesthetic and vasoconstricting properties found in cocaine. The local anesthetic effect of cocaine can be particularly effective for procedures involving the nose, throat, and upper airways. Besides, cocaine hydrochloride can also be used as a vasoconstrictor to manage bleeding by reducing blood flow to the site. Apart from that, healthcare professionals have historically used cocaine hydrochloride as a diagnostic tool for specific medical conditions, such as applying it topically to the nasal passages to diagnose and treat certain bleeding disorders. Also, when cocaine constricts the blood vessels, it can help them reduce blood flow and identify the source of bleeding. Substance abuse, also known as drug abuse, is the use of a drug in amounts or by methods that are harmful to the individual or others. Substance abuse can lead to serious health problems, including drug addiction, overdose, and death. Drug addiction, on the other hand, is the state of physical and psychological dependence on the use of those substances. As for cocaine, cocaine is a highly addictive drug that can be easily misused and have serious health consequences. Like other stimulant use disorders, cocaine use disorder is a stimulant use disorder where people continue to take cocaine despite its negative side effects. When a person abuses cocaine habitually, they will need more of the drug in more frequent doses to experience the desired effects. This is known as building up a tolerance, which usually indicates that a substance use disorder has developed. If so, any attempt to significantly reduce or stop one's cocaine use will result in painful, uncomfortable feelings or intense craving, known as withdrawal. Withdrawal symptoms can include nausea, vomiting, sweating, shaking, and anxiety. Side effects of cocaine use disorder can occur immediately after taking it and after long-term use. The immediate side effects, such as hypersensitivity to light and sound, paranoia, and high irritability. The short-term effects include high blood pressure and increased heart rate, which can lead to heart attacks, strokes, and other medical emergencies. However, long-term use of cocaine can lead to serious health problems, including irregular heartbeat, heart attacks, weakened immune system, strokes, organ damage, and future development of movement disorders such as seizures and Parkinson's. Let's look at how cocaine acts in our bodies. When cocaine is ingested, it is rapidly absorbed into the bloodstream and transported to the brain by affecting many different parts of the brain, including the brainstem, mesolimbic dopamine system, and cerebral cortex, which related with the brain's reward and movement pathway. Cocaine produces its effect by binding and inhibiting the function of monoamine transporters for dopamine, serotonin, and norepinephrine. Thus, inhibits the uptake of dopamine back into the neighboring neurons and causes an accumulation of dopamine in the extracellular space of the synapse to produce an amplified, stronger, and prolonged signaling with the pre- and postsynaptic neuron. This is what causes the pleasurable effect, such as euphoria, commonly experienced immediately after taking the cocaine.
Next is misuse of cocaine. People who use cocaine often take it in binge, taking the drug repeatedly within a short time at increasingly higher dose to maintain their high. The principal routes of cocaine administration are oral, intranasal, intravenous, and inhalation. The slang terms for this route are respectively chewing, snorting, malinging or injecting, and smoking. Snorting is the process of inhaling cocaine powder through the nostril, where it is absorbed into the bloodstream through the nasal tissues. Injection releases the drug directly into the bloodstream and heightens the intensity of its effect. Another popular method of use is to smoke cocaine that has been processed to make a rock crystal, also called freebase cocaine. The crystal is heated to produce vapor that are inhaled into the lung. This form of cocaine is called crack, which refers to the crackling sound of the rock as it is heated. Some people also smoke crack by sprinkling it on marijuana or tobacco and smoke it like a cigarette. Smoking involves the inhalation of cocaine vapor or smoke into the lung, where absorption into the bloodstream is as rapid as by injection. Cocaine use range from occasional use to repeated or compulsive use, with a variety of patterns between these extreme methods. There is no safe way to use cocaine. Any route of administration can lead to absorption of toxic amount of cocaine, leading to acute cardiovascular or cerebrovascular emergency that could result in sudden death. Repeated cocaine use by any route of administration can produce addiction and other adverse health consequences. Next is causes and risk factors toward cocaine abuse. Like all substance abuse problems, cocaine abuse is typically the result of many complicating factors. However, certain indicators have proven to increase one's vulnerability to drug abuse, and individuals who abuse cocaine are likely impacted by the genetic and environmental factors. As for genetic, if they have a first-degree relative who abuse cocaine or other harmful substance, they will be more likely to possess certain heritable traits that increase the likelihood that they will also struggle with addiction. For environmental, being in an environment where drug abuse is normalized as a means of coping with stress or as an acceptable recreational activity may mean that they will be more likely to engage in addictive behavior themselves. The other risk factors of cocaine abuse is being a person that tends to seek out high-risk activity, early exposure to drug or alcohol abuse in home, witnessing or experiencing traumatic event or abuse, and untreated mental health conditions such as anxiety, depression, or bipolar.
Cocaine addiction can manifest in a variety of ways, including behavioral, physical, cognitive, and psychosocial symptoms. Behavioral symptoms can be seen by the way they act and behave, such as lying about their whereabouts, associates, and activities, trying but failing to reduce one's cocaine abuse, acting with increased energy, reckless and risky behaviors, and also borrowing or stealing money. While physical symptoms that the user may have include rapid heart rate, lack of need for sleep, insomnia, dilated pupils, runny nose, persistent nosebleeds, excessive perspiration, increased body temperature, high blood pressure, loss of appetite, and energy bursts. Besides, cocaine abuse and addiction can also cause cognitive symptoms such as poor decision-making capabilities, euphoria, restlessness, irritability, psychosis, and the overabundance of confidence. Last but not least, the psychosocial symptoms, which are the combination of psychological and social symptoms that can be experienced by individuals with cocaine abuse disorder, are agitation, irritability, depression, anhedonia, mood swings, and withdrawal. Psychosocial symptoms can also be associated with other mental health conditions, such as anxiety and depression. Cocaine addiction or cocaine use disorder (CUD) can be treated with two types of treatment, which are pharmacological and psychosocial treatment. These two types of treatments are considered as an evidence-based solution or recommendation in managing this cocaine abuse. So, the pharmacological treatment include dopamine agonists, dopamine uptake inhibitors, anticonvulsant, psychiatric medication, cocaine vaccine, GABA modulators, and cholinergic medication. Meanwhile, the psychosocial treatment include intensive outpatient treatment (IOT), voucher-based reinforcement therapy (VBRT), and cognitive behavioral therapy (CBT). Dopamine agonists utilize stimulants like cocaine, such as amphetamines, caffeine, and nicotine, can acutely increase the available monoamines in the synapse, such as dopamine, noradrenaline, and serotonin. So, the agonist will regulate the dopamine level and reduce drug-seeking behavior that can cause dopamine hypoactivity. In brief, agonist treatment is a substitution approach that replaces the illicit drug such as cocaine with a medication that can stabilize functioning. This approach can help reduce withdrawal symptoms and cravings that can contribute to relapse and improve the chances of successful recovery. Other benefits of this approach include familiarity with drug effects that may promote medication compliance. One concern about this approach is that the medication used to treat cocaine addiction may be abused or can cause secondary abuse because it has similar effects to cocaine. So far, there is not enough evidence to suggest that medication used to treat cocaine addiction have a high risk of abuse or cardiovascular problems, and these include medication like amphetamine.
Next is anticonvulsant medication. Anticonvulsant medication, which is diazepam, are used to treat seizure in people with epilepsy, as these drugs are supposed to balance the dopamine system and effectively block the addiction-related effect of cocaine. Some studies have examined their use in treating cocaine users. Diazepam is one of several medications that have been used to treat alcoholism. It inhibits an enzyme involved in the metabolism of alcohol, making the experience of drinking very unpleasant, which is intended to discourage its consumption. Recent studies have indicated that diazepam can be used to treat cocaine addiction, as its mechanism of action results in a modulation of dopamine in users' brain.
For dopamine uptake inhibitors, a tested medication called modafinil has properties that affect the dopamine transporter. Modafinil prevents or inhibits the reuptake of dopamine transporter, leading to increased dopamine. By doing so, it reduces the excessive dopamine levels caused by cocaine use. Thus, by modulating dopamine reuptake, it can reduce the reinforcing effects of cocaine and consequently cravings for the drug. This is because the brain's reward system is less stimulated, making the drug less appealing. In a meta-analysis of 11 randomized clinical trials that compare the therapeutic outcomes of modafinil versus placebo, researchers found that 7 studies using modafinil to help people stop using cocaine did not show a clear overall effect. However, in a post-hoc analysis from one study, they noticed that people who didn't have a history of problems with alcohol (AUD) were more likely to have days where they didn't use cocaine when they were on modafinil. Another part of the study found that individuals with cocaine use disorder (CUD) but not alcohol problems (AUD) who took modafinil were significantly more likely to stop using cocaine in the last 3 weeks of the study compared to those who got a fake treatment (placebo).
The other treatment is by using psychiatric medication. There is two types of psychiatric medication, which is antidepressant and antipsychotic, that have been studied in the treatment of cocaine users. Antidepressants are normally used to treat people suffering from depressive disorder. This can be used to treat cocaine addiction, as cocaine use can lead to depression because it affects the monoamine system that involved in mood regulation. For this reason, antidepressants have been tested among cocaine users to see if they can reduce short-term post-cocaine depression and craving. Next is antipsychotic medication that are used to treat mental disorders such as schizophrenia and bipolar disorder. Studies have been undertaken to evaluate their role in treating cocaine users experience hallucination, delusion, and other psychotic symptoms.
anti-cocaine vaccine like TACD is a new way to treat substance use disorders by using the body's immune system. TACD works by making antibodies that attack the cocaine molecule. These antibodies stick to cocaine in the blood and stop it from getting into the brain because the combined molecules are too big to cross the blood-brain barrier. In a study with people dependent on cocaine, it was found that those with the highest levels of these antibodies had the biggest reductions in the positive effects of cocaine and thought that the quality of the cocaine was lower. Additionally, those with more antibodies tended to report a reduction in using cocaine.
Is GABA modulators. GABA is primarily an inhibitory neurotransmitter in the central nervous system. Activation of GABAergic neuron tends to decrease activity in the dopaminergic reward system. The mesocortical dopamine system plays a central role in the reinforcing effect of cocaine. Mesocortical dopaminergic neuron receive modulatory input from both GABAergic and glutaminergic neurons. Clinical trials of medication that foster GABAergic neurotransmission have suggested that this compound reduces the dopamine response to both cocaine administration and to conditioned reminder of prior cocaine use. GABAergic medication also reduce the self-administration of cocaine in animal models. So, GABAergic medication could prevent relapse either by blocking cocaine-induced euphoria or by reducing craving caused by exposure to conditioned reminder of prior cocaine use. Pyramide may be an excellent medication for relapse prevention based on its effect on both GABA neurotransmission and glutamate neurotransmission. Topiramide increases cerebral level of GABA and facilitates GABA neurotransmission. Topiramide also inhibits glutamate neurotransmission through a blockage of AMPA or kinase receptors. In animal models of cocaine relapse, blockage of AMPA receptor in the nucleus accumbens prevented reinstatement of cocaine self-administration.
Cholinergic medication, such as galantamine, is a drug that can be used to treat cocaine use disorder, CUD. It works by inhibiting the enzyme cholinesterase and increases the concentration of acetylcholine in the brain, which stimulates both nicotinic and muscarinic receptors, leading to improved concentration and attention. 2 trials have been conducted to test the effectiveness of galantamine in treating the cocaine use disorder, CUD. In a small pilot trial, galantamine was well tolerated and associated with reductions in cocaine use. In a larger trial, galantamine with dose 8 mg daily plus computerized cognitive behavioral therapy (CBT), which is one of the psychosocial interventions, was found to be superior to standard treatment such as methadone alone in reducing the frequency of cocaine use. These preliminary results are promising and warrant further investigation.
Next is psychosocial intervention, which is intensive outpatient therapy, IOT. IOT was shown to be as effective as inpatient drug treatment for the initial treatment of cocaine use disorder in the early 1990s and was found to be a cost-effective way to treat the large number of patients with cocaine use disorder who presented for treatment during that era. Most IOT programs consist of a combination of group and individual drug counseling, along with varying degree of family involvement. Standard outpatient drug counseling typically consists of 1 or 2 sessions per week, that typically between 30 and 60 minutes for individuals, while group sessions are 16 to 90 minutes in length. IOT treatment typically provide 9 hours of treatment contact per week. Patients with cocaine use disorder appear to fare better when they are seen several times per week compared to once a week. But IOT can provide some benefit even in relatively low-intensity treatments.
Voucher-based reinforcement therapy, VBRT, is a type of psychosocial treatment that rewards patients for achieving a therapeutic goal such as drug abstinence. Studies have shown that VBRT can be effective in promoting initial abstinence in cocaine users in outpatient treatment. Patients receive vouchers that can be redeemed for goods and services in the community. VBRT is most effective when used with community reinforcement therapy, CRT. This approach reinforces new adaptive behaviors that conflict with addictive behavior. VBRT is based on the behavior principle that a behavior that is rewarded is more likely to be repeated. A disadvantage of VBRT is often cost. However, lower cost variants of VBRT using intermittent reinforcement, such as the fishbowl technique, have also been shown to be effective. In the fishbowl technique, patients are rewarded for achieving abstinence by being allowed to draw from a fishbowl in which they are likely to not only achieve a smaller reward but also have a chance at receiving a much larger reward. Another limitation of VBRT is that the positive effects of the intervention on cocaine abstinence are not long-lasting, fading after the reinforcers are removed. Therefore, VBRT may be best used in conjunction with other therapies, such as CBT, that are more likely to achieve long-term outcomes.
Next is cognitive behavioral therapy, which is an effective approach for preventing relapse. Cognitive behavioral therapy focus on reducing or avoiding drug craving. Patients are taught to recognize the situation or state associated with prior drug use that provoke drug craving and to avoid this situation whenever possible. Patients are also taught a variety of coping skills to use when cocaine craving occurs, such as distraction, recall of negative consequence, and positive talk substitution. Cognitive behavioral therapy may be a particularly valuable intervention because cocaine-dependent patients treated with cognitive behavioral therapy often continue to improve after therapy is complete.
In conclusion, cocaine stands as one of the most commonly used illicit drugs globally, including in Malaysia. Regular cocaine use has been linked to a range of health issues, spanning cardiovascular, urological, and mental health problems, as well as an elevated risk of accidents and dependence. While psychosocial interventions such as intensive outpatient treatment (IOT), voucher-based reinforcement therapy (VBRT), and cognitive behavior therapy (CBT) traditionally serve as the primary treatment for cocaine dependence, where studies underscore the effectiveness of contingency management. At the same time, numerous trials are investigating and exploring diverse pharmacological treatments for cocaine dependence, including dopamine agonists, dopamine uptake inhibitors, anticonvulsants, psychiatric medications, cocaine vaccines, GABA modulators, and cholinergic medications. Eventually, I hope the future can present a hopeful narrative in the battle against cocaine abuse, emphasizing a collective and compassionate approach. With advances in treatment, technological integration, community empowerment, and ongoing research, breaking the chains of cocaine addiction becomes an attainable goal and offers a brighter future for individuals on the path to recovery. Thank you for your time and attention.